Good morning and welcome. This is Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on Your Women Radio 91.7. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays right here on this dial. My name is Miracle Phillip and I'm glad to welcome you to another day of Radio Doctor. And our Radio Doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you today?
I am doing very well.
I'm doing great, thank you. It's a pleasure having you on board today on Radio Doctor.
This is my first time doing a show with you. I'm glad to be here.
Thank you. On Radio Doctor today, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, will be consulting and advising on understanding infertility, what you need to know. And take note that the phone lines will be opened for you to ask your questions. And they are 07000 917 917. For women, you can reach us via our toll-free number, that is 0800 1235 917. And don't forget, we have an SMS or a WhatsApp line for you to drop your messages via 0703 175 6537. Don't forget to follow us across our social media platforms on Facebook, on X, on Instagram at WFM917. So we're heading to the discuss this morning. Because we are discussing understanding infertility, what you need to know with Dr. Abiola. Dr. Abiola, can you tell us what infertility is and how it is defined medically?
Yes, and first of all, this is one of my favorite topics lately because I deal with it so much in my practice, and the practice has evolved. I've been now in Nigeria for many years, and before I didn't see as many cases as I do now, and I realized that a lot of people are suffering from infertility, and a lot of them are suffering and don't have any way forward. So I thank you for inviting me on the program. To answer your question, infertility is medically defined as the inability to conceive after 1 year of regular unprotected intercourse, and we define unprotected intercourse at three times a week for 1 full year. So for women that are a bit older, over the age of 35, we typically reduce that definition to about 6 months. So meaning regular 3 times a week unprotected intercourse for 6 months. That's what we call infertility. Since I've been in Nigeria, I noticed there are a lot of social pressures and family pressures around this topic. So I typically don't wait for these, definitions 6 months or 1 year before I start addressing that problem with the people. But at home, follow along in a textbook or on Google. I'll give you the exact answer, and then later on tell you how I actually practice. We have 2 types of infertility: primary infertility and secondary infertility. Primary infertility is simple. It's just neither the man or the woman have ever been pregnant or gotten someone pregnant before. And secondary infertility means that one of the man or the woman may have been pregnant or gotten someone pregnant before, but now they're finding it difficult to conceive. That's one thing I always like to tell, because also we have some cultural, let me call them cultural stigma in Nigeria, where if we have infertility, it's the woman. So you don't know how many times I'll see some coming in for an infertility consultation, and it's just a woman, it's just a wife, it's just a fiance, or it's just a girlfriend. And when I now start telling them statistics that it's fine for you to be here, but 40% of the time it's a woman's issue. For another 40% of the time, it may be the male that has the issue. Leaving 20% or 1 in 5 will both have an issue. So nowadays I will not take a case if I cannot talk to and involve both partners, because at times you'll need to.
Well, thank you very much, Dr. Abiola. I'm so glad that you gave us this introduction and even classifying it as well, because just like you said, there are cultural nuances and stigmas to this particular subject, and people just classify it in one box, and then most times the woman is on the receiving end. So I love that we're getting more clarity, even as we delve in now. So what are the most common causes of infertility in men and women?
So I'll start with men. The most common thing I see is low sperm count. So and it's one of the most common corrective surgeries I do here. When you do a sperm test or when a man ejaculates, what you see visually is semen. That's a whitish fluid that protects the sperm, and that's generated from the prostate. And most men, when they ejaculate, you'll see semen. The sperm, which represents a very small volume of the ejaculate, comes from the testicle. And at times, the sperm can be low in number. We typically count them in what we call HPS, a high power field. You typically look at numbers like 10 million or 20 million. Some people have 100 million. Hopefully, when people call in with some of these, we'll dive in a little bit more about the actual sperm test. But low sperm count, poor sperm motility or poor sperm motion, meaning sperm have to swim. They swim in the semen, they swim in the vaginal canal, they find their way to the egg, and sometimes they do not swim well as in an abnormal shape. So all of these can cause infertility in men, and they can also affect the ability of the sperm to fertilize the egg. With women, some of the most everything centers around ovulation. So a lot of women feel like, first of all, I have to explain, menstruation and ovulation are two different things. Menstruation is what happens monthly when you see blood. That's the lining of the uterus, what we call the endometrium, shedding, and it rebuilds throughout the next cycle and sheds again at the beginning of the following cycle. Ovulation is where an egg in your ovaries matures, now takes the path through the fallopian tube and comes to the uterus to wait, hoping for sperm. Doesn't see sperm. Maximum an egg stays around is anywhere from 24 to 72 hours. Then it now gets reabsorbed and the cycle starts all over again. Most of the time, the issue with women centers around ovulation and where the ovaries fail to release their eggs regularly, or you've heard this term PCOS. And I think that maybe we'll come back next week and talk even more about some of these reproductive disorders more specifically. But PCOS can also affect it. Anything that also affects women's hormone levels can affect ovulation. And one I see also quite commonly, the tubes. We mentioned ovaries.
Yes.
After ovaries release an egg, they have to flow through the tubes. The tubes can be blocked. And at times I see what you call bilateral tubal blockage, which is both tubes are blocked. And that is, if both tubes are blocked, there's no way that woman can get pregnant normally. They will have to do something. And oftentimes those are caused by infections in the past. But those are the main things. Occasionally I see something called endometriosis. And then if anybody has had surgeries, especially pelvic or abdominal surgeries, they can cause these things called adhesions, and those can block tubes. And so I see that often in women as well.
Thank you very much, Dr. Abiola. I'm glad that we get to look at this together, even as our listeners are also paying close attention. If you've just tuned in, this is Radio Doctor on Your Women Radio 91.7, 13 minutes past 10. And we have with us our radio doctor for today, Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on understanding infertility, what you need to know. And don't forget that you can get to ask your questions via our phone lines 07000 917 917, our toll-free number for women 0800 1235 917, as well as our SMS and WhatsApp line that is 0703 175 6537. Dr. Abiola, you've talked about what infertility is, the common causes of infertility in men and women. But then the question of age would always spring up. So, what age does infertility typically begin to decline for both men and women?
Yeah, it's a great question. When we talk about decline in fertility or fertility decline, it's more pronounced in women than in men. For women, fertility tends to start declining gradually in their late 20s to their early 30s, and then have a more significant drop after the age of 35. By the time a woman reaches her early 40s, the chances of naturally conceiving or natural fertilization decrease a lot because of the reduction in quantity and the quality of her eggs. It's important to know that when a woman is born, you come out of your mother, you have all the eggs you're going to have. So women do not make new eggs. So as you go along, your body, some of them mature monthly, during ovulation, and get released, and that just decreases your number. Your number continues to decrease as you go on through life, and that is really what's tied for women with that fertility decline. The quality and the quantity of the eggs decline slowly from the 20s to the 30s, big drop around 35, and it's not the same for everybody, but we're just doing averages, and then a massive drop in the 40s. Men, on the other hand, produce sperm throughout their lives. For the life cycle of a sperm cell is between 3 to 4 months, and every 3 to 4 months, men will generate more sperm. However, the quality of the sperm, we talked about the shape, the motility, meaning how well they swim, all of those things can decrease with age. And for men, it usually, particularly after age 40, and you'll see sperm counts, reduced motility, which is movement, and something called DNA fragmentation. Well, we know that the egg has the woman's genetic material and the sperm has the man's genetic material, and when they meet, those materials combine. But the DNA in the egg can fragment, meaning it can break into pieces, just like the DNA in the sperm can break into pieces, and it may still end up with fertilization. But then if you have a sperm or an egg with poor DNA, the embryo, the developing baby, so to speak, may have genetic abnormalities, all kinds of issues. I just had a case, I don't want to get too graphic, but this child had part of the skull that was not forming, and we picked it on the ultrasound before, she got too far along, and I now traced it back to poor sperm quality. So, that's one of the main things for men. Not only does the sperm count drop, but the quality can also drop.
Really interesting, Dr. Abiola. Really interesting. But one would also want to know, as much as you said, yes, there are varying cases for different people, in women especially, and then also men. Are there some lifestyle factors, such as maybe diet and exercise, that can impact fertility?
Yeah, so I'm big, and I want to say slightly redefined my career in the last couple of years to include something called integrative medicine. Integrative medicine, we look at, traditional medicine, you present with a problem. I have a cold, or let's say I have a headache, and we give you a headache medication. Integrative medicine looks at the root cause of the problem. So is it something is it diet? Is it a vitamin or mineral imbalance? And all of those things. It's extremely fascinating. I would love if you guys will have me back. We'll talk about more about that. To answer your question, lifestyle and diet plays a huge role. I'm currently treating PCOS women with a combination of vitamins, minerals, and lifestyle changes. And I have a few of them testimonials on my social media where they're now pregnant. I have a lady, she's 20 weeks pregnant, another one 21 weeks, another 22. And the majority of it was I changed what they ate, when they ate it, and how they ate it. And this is not talking about pounding them with injections and pounding with tablets. The lifestyle, people put it far too low on their importance list. It's extremely important. A balanced diet rich in vitamins, minerals, especially antioxidants, are very, very important for reproductive health. And there's some vitamins. I think we'll also talk about this. Maybe we'll talk about reproductive disorders maybe next week, because there's a lot of good information. But basically things like folic acid, zinc, omega-3 fatty acids, those kind of things help support fertility. And being overweight or being underweight can also affect. That's part of lifestyle. Especially in women, can affect their hormone levels and their ovulation. Can also affect sperm production in men. Part of lifestyle is exercise. Regular exercise is always good. But if you look at some of these athletes or, people that exercise ultra hard, they can have issues with fertility because, especially in women, you'll see irregular or even missed periods. Some of these Olympic athletes go a year without seeing a period, and it's because of hormonal imbalance. So, and then finally, what we call social habits: smoking, alcohol, recreational drugs. All of those can affect fertility negatively by damaging the eggs, sperm, and even the reproductive organs.
Thank you very much, Dr. Abiola, for sharing that with us. And I think even more particular, it's the fact that you brought in athletes as well. So they also have their own struggles with this, even as they pursue something that they love doing. Well, if you've just joined in, this is 20 minutes past 10 on your Women Radio 91.7. And we have with us our radio doctor, Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on understanding infertility, what you need to know. Don't forget that you can actually drop an SMS or a WhatsApp message to 070-3175-6537. Our phone lines 07000-917-917, and if you are a woman, our toll-free number is for you 0800-1235-917. Dr. Abiola, now let's look at the signs and symptoms that someone might be experiencing infertility.
Yeah, infertility may not always present clear symptoms, but there are some signs that could indicate, potential problems. Like for women, irregular or absent menstrual cycles can be a key indicator of ovulation issues. And we mentioned ovulation issues are at the center of female infertility. If a woman is having painful periods, heavy bleeding, or even pelvic pain, pain in the lower part of the abdomen, it may also suggest conditions like endometriosis or fibroids, we see very, very commonly. And at times you may not just see the enlarging belly of fibroids, you may see some of these painful periods, heavy bleeding, and pain, and all of these can contribute to infertility. In men, some of the symptoms of infertility include, problems with sexual function, so erectile dysfunction, either difficulty with ejaculating, whether ejaculating too soon or too late or not at all. I see all three of those. And also difficulty with maintaining an erection, pain in the testicles or swelling in the testicles, or even changes in the way your hair grows could all signal hormonal imbalances in men and in women. And in both men and women, an inability, the first sign is that if a couple has been having unprotected sex for 1 year regularly, 2 to 3 times a week, and they have not conceived, that's usually the first sign of infertility. I hope that answered your question.
Oh, yes, it did. It did answer the question and even more. And I know that there's been conversations around, especially for people who live in Lagos and highbrow areas. There's the stress of going out in the morning, coming back late in the night, having to go about daily activities. How does this word stress affect fertility, and what can be done to manage it?
There's no doubt that the scenarios you described affect fertility, and all in a negative way. Stress can have a significant impact on fertility. High levels of stress can interfere with your body's normal hormonal balance, so that's now going to affect ovulation in women, and it's going to affect sperm production in men. Then we, especially in this part of the world, we tend to downgrade the psychological impact of stress, which can lead to a decreased interest in sex, decreased libido, which also reduces your chance of getting pregnant. And all of these play a role. So I also take that into account, which is why I like to see both partners, because to manage stress, it's important to engage in regular relaxation techniques, self-care, meditation is something that I am huge on. I would love to do a whole show on meditation. It's one of the main reasons why I'm able to survive in Nigeria. And maintaining a healthy work-life balance, like getting enough sleep, seeking support from friends, family, and your partner can also help. So for couples that are trying to get pregnant, reducing stress can be challenging. A lot of them say, well, I can't change my job or I can't do this. Yes, but you can focus on self-care, open communication, and seeking help from fertility specialists and listen to programs like this. It can really make a big difference.
Thank you very much, Dr. Abiola. I'm so glad that we had to touch on this very important, because it really does play a huge role, even away from fertility, even the normal functioning of a person's body and well-being. Okay, so if you've just tuned in, this is 25 minutes past 10 on Your Women Radio 91.7. And we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on understanding infertility, what you need to know. And yes, you can always be a part of the program by sending in your questions or calling us via our phone lines 07000 917 917, or via our toll-free number if you're a woman, 0800 1235 917, and our SMS and WhatsApp line, that is 0703 175 6537. Okay, Dr. Abiola, I want to still come back to this stress conversation. There are some people who would say that, well, it's not a matter of my work stress. It's not a matter of physical stress in any way to my body. It's more mental, more emotional. Does this also impact?
That's an excellent question. There's a field of medicine which I love everything we're talking about today. This is another field that I love. It's called epigenetics. And epigenetics focuses on, at the cellular level, does your mind, your thoughts, your mood, does it control things at the cellular level? And the answer is 100% yes. So your mindset, and in true reality, what you hold in your mind as your reality. If you go around and think, I'm sick, I can't get it up, or you just have these negative thoughts and negative mood and around anything, it will definitely impact you cellularly. It can affect your fertility, it can affect your heart rate, your blood pressure, your overall outlook on life, and your overall well-being is 100% directly affected by your mood. They even did these tests with plants. So they put 100 plants in one room, another 100 plants in a room on the other side, and in the one room they played, music that was, like Bach or Beethoven, this classical music, and with somebody talking, you're the greatest plant, you're going to grow so very tall, those kind of positive affirmations. In another room they played heavy metal music with the opposite type of speech. You're a terrible plant, you're not going to grow anywhere. Do you know that in every of the studies there was a measurable difference in the growth of the plants? It's just amazing. Wow. They did another study with twins, and twins that were undergoing cancer and other treatment together. The ones that had the better positive mental outlook always did better, or mainly did better, 76% better than the other one. So to say that those things are insignificant would be a misnomer.
Thank you very much, Dr. Abiola, for that clarity right there. And I'm sure a lot of people are going to pay closer attention now. I also want to find out, I know that people would say, well, I'm currently not married, so it's not a subject. But can lingering stress or stress that has been like inside of you, sort of like over time during your single period before you get married, does it have a way of affecting you when you get married? I don't know if you
Yes, so yeah, go ahead. Sorry.
Okay, I just want to know if you got that question right.
Yeah, so that's yes. The answer is yes. So when you have, whether you're married or not, you have this lingering stress. It's affecting. When I say affecting your cells, it affects DNA and gene expression. So I'm sure this research will come to bear, hopefully in the next few years. But I feel like some of these cancers, some of these breast cancers, some of these colon cancers, some of these different cancers can be tied, not all the time, but when we talk about environmental causes of disease, part of that is the environment that you are in. The environment, if you're in a stressful environment, whether you created it for yourself or not, it can affect you genetically. It can affect your DNA. It can affect gene expression is basically all we do. You take a DNA has genes and expresses for your hair, your mood, your serotonin. All these things are controlled by your DNA. So you can affect that with your mood and with your thoughts. It's powerful when you understand it, and it could be depressing if you don't.
Well, thank you very much, Dr. Abiola. All right, let's look at medical conditions as well. Conditions like diabetes or thyroid disorders, some which are also genetic. Do you think that they can lead to infertility?
Yes, the simple answer is yes. Medical conditions such as diabetes and thyroid disorders can definitely lead to infertility. Diabetes, especially when it's poorly controlled, affects men and women. In men, when I have a man, above the age of 40 that says he has erectile dysfunction or difficulty achieving erections, first question I ask is, do you have high blood pressure? Second question is, do you have diabetes?
Okay.
Immediately. And if one of those is true, it's usually the cause. For in men, it can lead to erectile dysfunction. It can lead to poor sperm quality. And in women, it can cause irregular menstrual cycles and difficulties with ovulation. And that's talking about diabetes. For thyroid, including there's something called hypothyroid, which is your thyroid gland doesn't produce enough thyroid hormone, and hyperthyroidism, which is an overactive thyroid. Both of those conditions can lead to a disruption in the delicate balance of hormones that are necessary for reproduction. When you're talking about female hormones, you have so many different hormones that go up and down over the course of, let's say, a month or a 28-day period of your cycle. So thyroid disorder can affect that balance. Low thyroid or hypothyroid can even cause people not to ovulate. And hyperthyroid typically causes irregular or very light periods, both of which can contribute to infertility. Oftentimes managing them through medication, lifestyle changes, and regular monitoring can always help improve your fertility outcomes. Very true.
All right. Thank you very much, Dr. Abiola. Well, if you've just tuned in, this is 10:30 on Your Women Radio 91.7. I mean to say 28 minutes to 11 on Your Women Radio 91.7. And we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on understanding infertility, what you need to know. And don't forget that you can be part of the conversation. The phone lines 07000 917 917. 07000 917 917. For women, you can reach us via our toll-free number 0800 1235 917, and SMS and WhatsApp line very much open and active 0703 175 6537. You can get to ask Dr. Abiola whatever question you have for him, especially on the subject matter this morning. Dr. Abiola, what role does genetics play in infertility, and can it be inherited?
Genetics can play a significant role in infertility. In some cases, infertility can be inherited. There's some genetic conditions that can directly affect reproductive function. In men, there's a syndrome called Klinefelter syndrome. I'm not trying to turn people or you into a doctor, but it's where men have an extra X chromosome. Men are supposed to be XY and women are XX.
Okay.
And sometimes these men often have low testosterone levels, and they produce little to no sperm. And any other, besides Klinefelter's, any other genetic condition that affects the sex chromosomes can affect men in their testosterone level. And testosterone is the prototypical male hormone that helps with not only sperm growth, but sperm maturation. For women, there's some syndromes like Turner syndrome where one of their X chromosomes is missing or partially missing, and they typically have something called ovarian failure, I mean the ovaries just aren't working. And then you talked about, can they be inherited? There's some genetic mutations that can be inherited, like cystic fibrosis. It's one of the most common ones. And in men, it can cause blockages in their reproductive tract. There's a group of genes called the BRCA genes or BRCA genes. In women, we've found out that they can point us in the direction of whether this woman would have breast cancer or not. We're also finding out that they're also linked to a higher risk of early menopause as well as infertility. So at times, genetic counseling and testing can help identify these risks and help guide your treatment. I don't always start with genetic testing because a lot of these genetic diseases I just mentioned, you see them in whites often. Klinefelter and Turner, you see them in whites more. Okay. Cystic fibrosis, it's been white people more. We don't see that as much here. But if I had, I studied in the U.S., but if I have somebody here that we've tried everything and not able to make any headway, then I would definitely consider genetic testing.
And how is infertility diagnosed? What tests are commonly used?
Oh, the best thing to do is before you start testing, take a very thorough history. Okay. And a physical exam. I don't know how many times I've heard stories of patients seeing doctors for infertility or other things, and the doctor never touches them. Never does a physical exam. Check for prostate enlargement in men, check for breast lumps in women, check for fibroids in women. You can feel them through the skin sometimes. So thorough medical history around the infertility, physical exam, and then, like I mentioned at the beginning, I like to do tests for both partners. So for women, everything centers around hormones. So there's some hormones like FSH, LH, AMH, all of these can give us signs into their ovulation. Remember we said for women, infertility usually centers around problems with ovulation. And then we can also gain insights into something called ovarian reserve. So if I have a woman that's above the age of 35 and she wants to know about her fecundability, meaning how likely am I to have eggs that are worth it, that are going to, that could be fertilized, there are some tests that you can do and say that, this is a certain percent chance, or we can even estimate their ovarian reserve. At times, or almost everybody will get a pelvic ultrasound where we're going to look at the ovaries, the uterus, and look for any abnormalities. A test that I do very often here is something called an HSG or hysterosalpingogram. Very long word, just to look for whether or not those tubes are open. And we talked about ovaries, mature eggs, now to go through the fallopian tubes, and if the tubes are blocked, it's impossible to get pregnant. So there's a X-ray test that we can do to make sure that the tubes are open. At times, we see one tube blocked and one tube open. And I'll usually give that woman an option we can do some procedure to try and open the other side, or knows that's not a quote-unquote test, and you can still get pregnant with one tube. It just reduces your chances by 50%. For men, after the history and the physical exam, a sperm test, or what we call a semen analysis, is key. In that semen analysis, we're going to find out their sperm count, the motility, or how well the sperm move, and morphology, or the shape of the sperm. You want to have a high percentage of fast-moving, normally shaped sperm, and as many as possible. Anywhere from 20 million to 200 million is the normal. So we have hormonal tests. We talked about genetic screening earlier, physical exam, especially of the reproductive organs. And then in some advanced cases, we do laparoscopy, meaning we put a camera in the belly, blow the belly up with carbon dioxide, and we look around. We're looking for endometriosis on the camera. So this is a very small incision, about the width of your thumb. And we can look for things like endometriosis and even look to see if the tubes have been damaged. Exciting stuff.
Wow, that's a lot. That's a whole lot. And Dr. Abiola, one would wonder, is this something that people who are not married can then, go for tests, like do the full body test, full fertility test, just in case?
I have a considerable number of people engaging in that. So I have people um, like I have some men that say I want to get married in the future. I don't know who I'm going to get married to, but I just want to do a check. Yes, that's possible. And the same for women. And I've seen something in our culture now that sometimes some families are asking the woman and the man to ensure their reproductive health before going through with the marriage. It's becoming more and more common these days. You've probably heard about it.
Yes, I
Maybe
have.
even more than I have. I've had somebody close to me where they were not allowed to get married until she proved that she could get pregnant. Before getting married, it turned me upside down. But I've seen that it's becoming more and more common. So yes, that's possible.
All right. Thank you very much, Dr. Abiola. Well, if you've just tuned in, this is 20 minutes to 11 on your Women Radio 91.7, and it is an insightful time with Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on understanding infertility, what you need to know. And I tell you, the phone lines are open. It's 07000 917 917. 07000 917 917. You can equally reach us via our toll-free number if you are a woman, 0800 1235 917. Don't forget we have our SMS and WhatsApp number, that is 0703 175 6537. Okay, we'll come back to this conversation now. Dr. Abiola, what are some of the treatment options available for couples who are struggling with infertility?
Yeah, for infertility, it depends on the cause, right? So for women, we mentioned that most of it centers around ovulation disorders. There's medications, and I've never mentioned medications on the radio, but there's some medications that can stimulate ovulation. And then if there's some structural issues like blocked fallopian tubes, then maybe surgery may be necessary. There's a procedure that I have been doing very frequently. I think I have 3 or 4 of them today, where it's not a full surgery, it's a procedure in the theater to try and unblock these tubes called hydrotubation, and it's making a comeback. So just depending on the cause, but for men, some of the treatments may involve medications to improve sperm. So after that sperm test, if we see something called oligospermia, which is low sperm count, or we see a lot of strange or abnormal forms, there's some medications to improve sperm production.
All right.
And I do surgeries to correct blockages. At times, I just did one 2 days ago. At times there's a blockage to the path of the sperm from the testicle to the prostate. This gentleman had hernia surgeries in the past, and during those hernia surgeries, they had affected his spermatic cord, and so his semen test showed 0 sperm, and that's called azospermia. It's demoralizing, to say the least. And I ended up having to go and take a biopsy from his testicle, go into his testicle and take a sample to see if there was any sperm production there at all. Thank goodness we saw a few. So now I'll do surgery to correct the blockage, and hopefully that'll work out. There's assisted reproductive technologies, which goes under the acronym ART, which some of them are IUI, which is intrauterine insemination. It's where you take the sperm from the man, there's a buffering and concentrating solution, and you now inseminate the woman with it. Or what a lot of people have heard about, IVF, or in vitro fertilization. Those are common options when some of these other treatments are ineffective. I'll make one quick point.
Okay.
And remind that, men, we talked about men, sperm turnover is every 3 to 4 months. So I see some people with poor sperm quality or low sperm count, and they undergo treatment for 2 weeks. That does not make sense. They undergo treatment for 1 month. Doesn't make sense. You have, whatever you're going to do, you need to carry through the whole turnover cycle. So I typically carry my patients 3 to 4 months of treatment, and then we check again, and usually we have good results. With IVF, we can retrieve eggs from the ovaries and retrieve sperm from the patient, in the man, and we fertilize it in the lab, and then now transfer the fertilized embryo back to the uterus. And those are some of the main treatment options. I'll also talk about lifestyle modifications, and we've done a few where we take donor sperm or donor eggs. Nigerians don't like doing that as much as we do in the States. I can understand why, but I've been involved in a few of those where we have donor sperm, donor eggs, or even surrogacy. These are all options that could be considered based on everybody's circumstances.
Thank you very much, Dr. Abiola, for answering that question. And I see that you made mention of IVF. One would wonder how effective this particular, treatment is in helping couples conceive.
Yeah, IVF is one of the most effective treatments for infertility, but the success rates vary wildly. A lot of factors play into that. The woman's age, which makes a difference because we talked about egg quality and egg availability, so the woman's age plays a large role. Whatever the cause of the infertility also, plays a role. And on average, IVF for women under the age of 35, the success rate is about 40%, 40 to 50% maximum. That's per cycle. So if you, and I warn people, if you're looking at a hospital or a center advertising IVF and they're advertising rates higher than 40 to 50%, it cannot happen. Even if they're advertising rates of 40%, you need to find out how many cycles that includes. Because in the U.S., we use insurance. So for IVF, we implant one egg. If this doesn't work this cycle, you just try another cycle. You try another cycle. So within 3 cycles, typically 50% of women will get pregnant. But in Nigeria, we're paying in cash, and most of the time, and it's extremely expensive. So it's demoralizing if somebody has to go and gather up all this money. You go through IVF and you think, oh, it's definitely going to work. No, it has a 40% chance at best to work. But as the woman ages, over 35, which is when I typically see people doing IVF, that's the majority of them are over the age of 35, the success rate drops to 25%. So that's 1 in 4. And that's anywhere from 35 to the early 40s. So you can increase your success rate by using donor eggs, especially for older women. But we just remember that if you're going to do this, just have it in your head that 25% above age 35 and maximum of 40 to 50% below age 35. But it can offer hope, to many couples. And there's one new piece of technology, something called pre-implantation genetic testing, where you can actually test the embryo before you put it into the woman, and it's starting to gain traction here. It's also part of where people do sex determination. So if somebody wants to have a boy, there's some ways you can have an 80% chance of having a boy or 80% chance of having a girl. All of those can be addressed during the IVF consultation.
All right. Thank you very much, Dr. Abiola. If you've just tuned in, this is 13 minutes to 11 on your Women Radio 91.7. We have with us Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, who is consulting and advising on understanding infertility, what you need to know. The phone lines are open. I'm sorry I missed the call, but you can do well to call us back and we'll get to answer your question because, we have Dr. Abiola live right now. So you get to ask your questions and also send your messages as well. And Dr. Abiola will be right here to answer for you. Now, Dr. Abiola, are there any risk or side effects associated with these infertility treatments that you've listed?
Yeah, there are. Everything has side effects. Waking up out of bed, you could fall on the floor. Everything has side effects. Infertility treatments, including medications, surgery, and those assisted reproductive technologies like we talked about, like IVF, they come with some risks. The medications that help stimulate ovulation, and there's some common ones, can lead at best to mood swings, hot flashes, and because you're affecting the woman's hormones, right? And also a syndrome called ovarian hyperstimulation syndrome. That's the worst. It's where the ovaries become swollen and painful, and in severe cases, they can be ruptured and fluid can build up, in the abdomen, leading to breathing difficulty, bleeding disorders, and even blood clots. So it's scary if people are taking fertility medication over the counter without being directed by, a doctor versed in fertility. Some of the surgical procedures we talked about for infertility also have risks typical of any surgery: infection, bleeding, damage to surrounding organs. We would do surgery to remove endometriosis or fibroids or adhesions, those kinds of things. Even IVF, has its risks. One of the risks people see as a benefit here, and this is why it's interesting to contrast Nigeria and the U.S. In the U.S., it's a bad, when somebody's going for IVF, they want one pregnancy. One of the risks of IVF is that there's an increased risk of multiple pregnancies, of like twins or triplets. But here, I don't think I've seen a patient that wouldn't have been happy if it had been twins or triplets. But it can pose an additional risk because if the mother is older, the more babies, the more strain on her, the higher chance of having preterm birth and low birth weight.
Okay, Dr. Abiola, I would like to pause your thought. Let's take this.
Oh, sure.
Hello, good morning.
Good morning.
Yes, what's your name and where are you calling from?
My name is Miracle, calling from Ibafo.
Miracle from Ibafo. Glad to have you.
I want to ask questions.
Okay, go ahead.
What causes infertility in a man and woman?
Okay, what causes infertility in a man and a woman? Okay, well, we've been talking about this extensively with Dr. Abiola. I don't know what time you tuned in.
I just tuned in now.
Oh, okay, no problem. Thank you so much for calling in. Well, Dr. Abiola, seems like she just wants a refresher on the causes of infertility in a man and a woman.
We'll do that really quickly for Miracle and Ibafo. Thanks for the call. In men, some of the most common causes are low sperm count, poor sperm motility or movement, and abnormal sperm shape, And in women, the most common causes center around ovulation, where ovaries do not release eggs. Things like PCOS and hormonal disorders are large causes of infertility in women, and also age-related decline. As you get older, your woman's eggs quality and the quantity reduce, especially after the mid-30s. So these are all factors or causes of infertility.
All right. Thank you very much, Dr. Abiola. I know you were saying something just before we cut off, before we had to take that call. I don't know if you still remember that.
Yeah, I think we were talking about
the
risks
side
of
yes.
Side effects. Yeah, the final one is that using some of these fertility medications can increase the risk of something called ectopic pregnancy, where the pregnancy does not end up in the uterus. It ends up outside of the uterus, usually in the fallopian tube, and that is a surgical emergency. So if anybody ever has ectopic pregnancy, that's a surgical emergency. It's not something you want to sit at home and watch. You need to get right in.
All right. Thank you very much, Dr. Abiola. And even as we wrap up, how long should a couple try to conceive naturally before seeking medical help?
I'll abbreviate the answer because I think we're running out of a little bit of time. But for couples under 35 years old, like I said, the textbook definition is wait at least 1 year. But above 35, we talk about age-related decline, so it's advisable to be a little bit faster, maybe 6 months of trying before you now seek help. But like I said, in Nigeria, once the couple is worried or one of them is worried about it, I will intervene in some way. It may be just counseling or something, but typically under 35, over a year or plus, that's reason to be concerned. Over 35, 6 months is not because you should get pregnant faster when you're older. It's just because you have less time to correct the issue. So, but that's what we typically tell them. Now, if your partner has a known risk factor for infertility, like what we've talked about, irregular menstrual cycles, history of pelvic infections or what they call torus infections, testicle injury, all those kind of things, then it would be wise to seek evaluation sooner.
All right, and just very quickly, because this one just came to mind. I know
Sure.
there are couples who decide to do some sort of family planning. Say they get married in time, but decide to stay like 2 years, 3 years before starting to have children. How do they now identify some of these issues?
Well, that's family planning and family spacing is a great concept, and I applaud people that plan their lives. When depending on what type of family planning, there's some permanent ones and there's some not permanent ones. The non-permanent ones we can remove, we can adjust, and usually within 3 to 6 months, the person is restored back to their baseline reproductive health. So. It's not that you should be afraid to use those things, but you should just give yourself at least 6 months to recover from it before moving, before actually getting worried about being pregnant.
All right. Thank you so much, Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, for today's free consultation and advice on understanding infertility, what you need to know. Thank you so much. I'm sure a lot of people want to reach out to you on your social media pages. You want to let them in on that?
Yeah, thank you for having me on today's show. Infertility is complex and it's personal, but you're not alone. I don't mind helping, and our socials are ROA Specialist Hospital on Facebook, Instagram, Twitter, and ETHEROAhospital.com. And my number is there. You can reach out, appointments. Anybody that mentions WFM, I usually do free consultations for them. So don't hesitate to consult us, and we'll take it from there.
All right. Thank you very much, Dr. Abiola, for joining in today. It's always a pleasure.
My pleasure. Talk to you next week.
All right. For a consultation, you might just want to grab a pen and a paper and get this one so that you can reach Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital. The phone line is 0913 579 5108. I repeat, 0913 579 5108. You can also reach +234 816 601 4901 for an appointment and also for directions, and get to visit www.theroahospital.com. Thank you so much for listening in today. Radio Doctor is Nigeria's first specialized health